Hello everyone. In this video we're going to be talking about the pathology of bronchiectasis. So let's start. So what is bronchiectasis? So it is a chronic condition where the walls of the bronchi become thick due to inflammation and infection in the bronchi, and this leads to permanent dilation of the airways. Now, what are the causes of bronchiectasis? So, it can be caused due to some congenital conditions such as cystic fibrosis, primary ciliary dyskinesia, or Carter-Jenner syndrome. We will see why and how these conditions can lead to bronchiectasis. It can even be caused by some very serious infections, for example, due to bacteria, out of which TB is the most important one that you have to remember. It can be even caused by certain viruses and even fungi such as Aspergillus fumigatus. This is also important to remember. Apart from this, it can be caused due to any obstruction in the airway, which can be due to tumors which compress the bronchi, or even foreign bodies such as a peanut. It can also be caused due to immune disorders such as SLE and rheumatoid arthritis. Finally, my favorite part, the pathogenesis. What exactly happens here? So, any condition which leads to the dysfunction in the mucociliary clearance will eventually lead to the buildup of bacteria or pathogens in the respiratory pathway. And because these pathogens will not be able to clear up and will keep on increasing, it can lead to chronic infection. And this chronic infection can finally lead to bronchiectasis. So, to understand this properly, we should know what is mucociliary clearance and how it normally functions. So take this as a representation of a microscopic pic of the bronchial wall. Now you must all be knowing that we have the cilia lining the respiratory pathway. And we also have a layer of mucus which lines the pathway. In this pic, it is represented in green. So what happens normally? Whenever a bacteria or a virus or any particle enters, it will normally come and stick to the mucus and the cilia which line the pathway. These cilia will beat in an upward, rhythmic and coordinated fashion towards the pharynx. This movement will cause the particle to go up and finally be thrown out of the body. Now remember the congenital conditions that we just talked about? Let's see how those can cause bronchiectasis. Starting with cystic fibrosis, what exactly happens here? So there is a very thick and viscous mucus layer which lines the airways. This will lead to chronic infection. How? Let's see. So again, some pathogen will enter and again it will attach to the lining of the bronchi. But this time, because the layer is very thick, the cilia will not be able to move properly. Think of it this way. Imagine you're submerged in a swimming pool. You will be able to wiggle your hands and legs pretty freely, right? Now imagine that water is now replaced with a very thick honey. You won't be able to wiggle as freely as in water. A similar thing happens here. The cilia, because of the thick mucus, will not be able to move properly. Now, because this pathogen is not removed, it can cause chronic infection which can finally lead to bronchiectasis. Now, what happens in primary ciliary dyskinesia? This one is pretty easy to understand. So the cilia themselves in this condition are dysfunctional, meaning they are not moving. So again, if a pathogen enters, it can lead to chronic infection and finally bronchiectasis. Now, what will the lungs look like in this condition? So since we have chronic infection, it will lead to the destruction of smooth muscles and elastic tissue. This will lead to the dilation of the distal bronchi and bronchioles. So this is the main crux of this video, that there is dilation or widening of the distal bronchi and bronchioles. The airways may be dilated up to 4 times the normal size. Also, mainly the lower lobes are affected in this condition. On the cut surface, the bronchi may look very dilated and filled with mucopurulent secretion. So this is a cut section. In this photo, you can see that the bronchi are very dilated and also that the lower part of the lung is mainly affected. Now, what are the clinical features in this condition? There can be fever, there can be severe and persistent cough, there can be bronchoria and dyspnea. Also, very important to note, tram track appearance is seen on X-ray. So this is an X-ray and you can see that there is this opacity in this part. So this appearance is actually called the tram track appearance. Now in this CT, can you notice something abnormal? You can see these circular structures which are actually dilated bronchi, but compared to on the other side, there is no dilation. Finally, how are you going to treat this condition? So we can use mucolytics such as Dornase or DNase. We can use high frequency chest oscillatory devices which literally vibrate your chest and help in throwing out the mucus and clearing the airways. And finally, antibiotics if there is any infection. So that's it for this video. If you have any doubts, so please leave them in the comments, or you can message me on Instagram anytime. I will be leaving the link to my Instagram in the description. Thank you.